looks at service delivery at the local government level, but in areas which pertain people's lives. You'll find that resources in terms of government financing has been restored towards decentralized services. In terms of education, in terms of healthcare, in terms of water and other facilities, education, we have been supporting the construction of seed secondary schools through this program.
The beginning of UgIFT program in the area of education and health is very good because earlier on, they were in a secondary school, they did not have desks, they didn't have proper classrooms, they didn't have sanitation facilities. But under UgIFT, classrooms were permanent, providing the laboratories, which were not heard of those days. They're also providing reagents to actualize the laboratories, and they're also providing the sanitary facilities.
Before the construction of the school under UgIFT, Bumilisa Secondary School had only 13 teachers. This school was operating under trees. Many students were walking long distances. It's over 27 kilometers.
You can be there sitting in class, you're squeezed, you're sharing on one desk, you're sitting like 5 people. We never had practicals because there were no materials to be used.
We would really get students, but because of what I would call funny structures, they could not sustain a learner. These students needed practicals, they needed so many things that were lacking at that time.
The school was remote, had no structures. We had no equipment in the laboratory. So the head teacher could take the responsibility to borrow the equipment from neighboring schools for his students to take laboratory tests.
The government has equipped Kimenyede Seed School with lab equipment, with furniture, with computers. It has also given them teachers, although we still have only 17 out of the required 32. The school still lacks power, but there is a provision and application has been made to Meme.
We haven't had enough yet because according to the government program, each sub-county is supposed to have a secondary school. And at the moment, we don't have that number. We have 42 sub-counties. So we needed 42 secondary schools, but we don't have that number. We have about 12 in total. So there are 30 sub-counties that only have government secondary schools.
So my overall assessment of the performance of the World Bank portfolio is that it's a bit slower than we'd like for various reasons. I think the first one being that the way that it's structured, we have a lot of the design happening as part of the project. A second reason is that we don't necessarily always have the tools in place, the systems in place, the capacity in place to make sure that things such as social and environmental safeguards are taken on board early, that the procurement is done according to the specifications, and that the contractors, suppliers that are supposed to be part of the program are well prepared and available to provide the services that government seeks. The fact that the school is full of students is very encouraging. This is a conducive environment that they're in, and that has helped, I think, to make them be interested in being schooled today, and so very, very good to see that happening. Good to see also the teachers and to see the accommodation, to see the blocks that have been built, the labs and the library and the IT offices. So I think the next thing which will be important is to get the school finished as soon as possible in order for the full benefits to be achieved.
The intervention has seen the construction of 117 seed secondary schools in sub-counties. 77 of these have been commissioned.
Under UgIFT program, the interventions mainly in health and education, those are the key drivers of any development in a district. If you don't have educated population, you don't have healthy population, then you cannot be proud that you are developing in the district. So once you have these two, people are healthy, people are educated, that is already a contribution to a development in the district in all ways.
Government has also been supporting investment in healthcare by upgrading the Health Center 2 to Health Center 3 in sub-counties without.
Formerly, the health facility was operating in just one block, without a maternity wing, without an inpatient wing. we were only doing OPD, though we used to offer some services that are focused on mothers like antenatal. And with that, when it was still a health center too, the first challenge that we had, staffing of health center too, was very small, and we used to get children who are very sick, but because we do not have inpatient department, we would not be able to attend to them.
Before the support from UgIFT came in, we've been only having 3 services offered. That was antenatal, family planning and immunization. But of course there were some challenges whereby a mother, since you're offering antenatal services, if you're to refer to a health center 3 for deliveries, she will not go, she will come in the night, like at 2 a.m. and we had no delivery beds. But after being upgraded to health center 3, we have mothers coming in big numbers to acquire these services. Because formerly we would have like 50 mothers, 90 for antenatal, but currently we have over 200 mothers attending antenatal services from Uganda Health Center 3, and our deliveries, since we began in July last year, we've shifted. We can have even 60 mothers just in a single month.
With the construction of this building, it helped upgrade the Health Center 2 to Health Center 3. With Health Center 3, services that are provided, they increase compared to Health Center 2. We have maternity services coming in, also inpatients, patients who are admitted and managed, then they go home.
In the beginning, we could refer mothers for HB, blood cross matching to Shongororo, but all of them, they are done here.
It has improved the way we work because the upgrading of the facility brings in more staffing, and you find a community is served than traveling longer distances to go and seek services from advanced centers.
We have got maternity services, postnatal services, family planning services, including long-term services to mothers, laboratory services which were not done originally when it was Health Center 2 have been provided also to clients.
When the facility got upgraded to Health Center 3, we were adding the laboratory, and now we can do the testing. But previously, the person seeing patients was the same person to run the tests for the patients. After this upgrade, even the patients now are able to get more services. Our mothers who used to go to very far health facilities for deliveries can now be delivered here.
The government is currently upgrading 337 Health Center 2s to 3s, constructing 12 new Health Center 3s, and has proposed 19 others for construction. Over 50 upgraded Health Center 2s are fully operational and are providing the required services to our mothers and communities.
We love to thank the government of Uganda in partnership with the World Bank for the upgrade of the health units that they are providing to the people. We thank the World Bank very much, especially people of Uganda. We are so proud of World Bank, especially Kashozi Health Center 3.
I would like to thank Ministry of Finance and World Bank for having brought UgIFT program in Stronko district, whereby Uganda Health Center 3 has benefited from its programs and services.
UgIFT project in Mukono has implemented the construction of micro irrigation systems, 3 of them so far, and those are on demonstration scale. Government is also providing for more than 140 mini irrigation systems this year as a rollout project, and will also give out more than 600 next year.
The program in itself starts with reaching out to the farmers. We reach out to them, teach them what is going on. So when they express interest, we visit the farm, assess what they have on the farm, the technical ability for the farm to host a micro-scale irrigation project, which includes water sources, the land holding, if they own the land or not.
When this program came into force, it was identified that I was qualifying for the project because I had enough land that was required and the water source. That was the first advantage I had. Then they brought in the equipment of the irrigation system, which was a very big problem for my income. It was including a water tank, a submersive pump, and the whole design of the garden, which was very expensive.
UgIFT is spearheading the kind of program and project that the bank is expanding into rapidly. You know, as you can see behind me, how much has been growing and the irrigation and the benefits of the irrigation that are going to allow him to continue through the dry season. We're seeing also there's both cabbages, passion fruit, and we've also seen the mobile solar panel and the borehole pump.
Having had that chance of getting that equipment, I found it very easy, like you are seeing now. We had planted cabbages and the passion fruits in the past dry season, but you can see how well we have managed. We went through that dry season and we have already started harvesting the cabbages, and we have already started having the first fruits. We received about 20 pieces of the passion fruits as a first crop, and with that water system which is in place, we shall be able to cover all what we want.
Over 137 farmers have received equipment. The program has committed about 3.3 billion and 820 million has been collected from farmers co-funding.
When it's a solar powered system, the government contributes 75% and the farmer contributes 25%. If it's petrol powered, it's the other way around. The farmer brings 75%, the government gives 25%. So we encourage these farmers as much as possible to go for the renewable energy.
Also hear that it's generated a lot of interest from other farmers in the locality in the context of this program to really push forward on the service delivery in education, health, micro irrigation and water. That is at the topmost mind of the Ministry of Finance and the government, and we continue to engage and support to ensure that's the case.
When we set up the project, we work hand in hand with the farmer to reach out to the community around them, encourage them, teach them, receive them at the farm, be able to teach them what is going on, and then encourage them to adopt. So this farmer stands as our ambassador to the rest of the farmers.
The community has already had hands-on, because as they come here, I train them as to how we have been doing with our crops here, and some already have started planting, though using the normal way of irrigating with cans, which takes them to be very expensive. You cannot go on with this portion of land with cabbages when you are using hands. But with this driving system, every drop that comes in goes to the plant. And you have an advantage of either putting in the chemicals, the fertilizers in that tank, so that every drop that comes down will be fertilizing the ground and the crop also.
UgIFT, under Water and Environment, the government has invested in the provision of water to unserved parishes and villages.
We had previously facing issues serving Kawambiro sub-county, safe water. Among the sub-counties that were water-stressed, Kawambiro was one of them. And we had several interventions to give good water to that sub-county. But the unfortunate part, we had no source of funding. And when we got an opportunity to get a UgIFT funding, we had to bring in more IPs and national water to increase on the capacity of the reserve, which was existing, such that it can continue serving Kamwenge Town Council and also serve Kawambiro sub-county.
Through such interventions, there has been construction of 48 new piped water systems, 421 deep boreholes, rehabilitation of about 394 boreholes, rehabilitation of 7 piped water systems, and extensions on 29 existing piped water systems. UgIFT is supporting the integration of delivery of services to refugees and their host communities in education, health, and water supply services.
For us as a district, Kiriandongo, we had about 3 sub-counties that had no government grant-aided secondary school as per the policy, because the policy says every sub-county at least must have one. And we have these refugees from South Sudan. We have a school which was constructed here in Kiriandongo under the same program. And the school is called Kitwara Seed Secondary School. And this is a community-based school which was there struggling and under tuition. That's where they were operating from. And the papyrus mats before the intervention.
Because we had a problem of our students moving from here up to Kiriandongo. From here up to Kiriandongo is around 7 kilometers. So after getting this support, we're getting our children from here.
Has been the ability of this program to encourage us to target resources to service delivery. at that lower level where the people are, on especially getting the education sector, having infrastructure, and at the same time focusing on the non-observable part of this education and healthcare, which is wage and the non-wage funding.